Hi everyone, I am Ahmed Ged from BTech. In this video, I will discuss with you some of the repeated questions in the exam, and I will show you how to deal with them. Let us start here with the first question, which say, which of the following is not the side effect of levodopa? First thing, we must take care about two words, the word not or except. So here in this question, he asked about the levodopa side effect and the side effect which is not of the side effects of levodopa. Let us see the choices. We have here dystonia, insomnia, hypertension, or vivid dreams. We know two types of side effects, peripheral and central. From central side effects, we can see that there is an insomnia, there is a dystonia, and there is a vivid dreams. All of those are central side effects of levodopa. So the three choices are correct. While the choice number C, he said hypertension. We know that levodopa cause orthostatic hypotension. Levodopa cause orthostatic hypotension. So the hypertension here is the choice, which is not the side effect of levodopa. Another question here. Tyramine food is contraindicated with all except praguline, phenelzine, sertraline, and tranylcypromine. All of us knowing that tyramine food or foods containing tyramine is contraindicated with all drugs which of MAO inhibitor or monoamine oxidase inhibitors, because those drugs inhibits the monoamine oxidase enzyme, so that this enzyme, the effect of this enzyme is a decomposition of norepinephrine or epinephrine or dopamine, so that when we inhibit this enzyme, the concentration of norepinephrine or epinephrine increase in the blood and lead to hypertensive crisis. So tyramine food or food containing tyramine will inhibit MAO inhibitors, and then inhibition of decomposition of norepinephrine or epinephrine, and then increase of epinephrine or norepinephrine, and leads to hypertensive crisis. So let us see the choices here. All choices are MAO inhibitors except sertraline, which is serotonin reuptake inhibitor, not MAO inhibitor. Praguline, phenelzine, and tranylcypromine, all of those are MAO inhibitors, while sertraline is serotonin reuptake inhibitor, SSRI. So the choice here will be sertraline. Another question here. Drug of choice for treatment of trigeminal neuralgia is carbamazepine, chlorpromazine, isocarboxazide, chloral hydrate. Of course, the choice number one, choice number A, carbamazepine. All of us knowing that carbamazepine have many uses. One of them is in treatment of trigeminal neuralgia, and also can be used in epilepsy and in manic disorders. Question number 4 here is related to patient counseling. In the exam, we will find some questions related to patient counseling. They asked about how to deal with the patient in some cases or some drugs. In this question, he said, what is the most appropriate counseling advice would you give the patient taking benzyl peroxide cream? Benzyl peroxide cream is a cream used for acne. So there is some patient counseling you should tell the patient about them. Here, some choices. What is the best one of those? Let us see the choices. Number A, avoid contact with hair. Number B, it can cause stain on colored clothes. Number C, if patients have to use benzoyl peroxide during the day, advise them to use a sunscreen and avoid unnecessary sun exposure. And number 4 or number D, should use this product no more frequently than every other day because of its irritating properties. Although it have an irritating properties, but the use of benzoyl peroxide should be daily, not on other day. Also, benzoyl peroxide not cause staining for the clothes. So the most appropriate choice is number C. If the patient have to use benzoyl peroxide during the day or exposed to the sun, he must use or apply a sunscreen before exposure to the sun. Number 5. After constant intravenous infusion, plasma steady-state concentration depends on T-half, volume of distribution, clearance rate, or dose. Actually, the effect of T-half or volume of distribution or the dose, if the drug in constant infusion rate, there is no effect. The only effect here will be the clearance rate. If there is an increase in clearance rate, the drug will clear from the body more faster. So the only effect here will be the clearance rate. Number 6. After intravenous bolus administration, initial plasma concentration depends on dose, clearance, apparent volume, or T-half. This question looks like the previous one, but in this question, he asked about the intravenous bolus administration. In the previous one, it was the intravenous infusion. So here, in the intravenous bolus administration, all of us knowing that all the drug or all the concentration or all the dose of the drug will reach the blood at once. So the maximum or initial concentration reached at the time of administration. So the initial plasma concentration then depends on the dose, not on clearance or the volume or the T-half. So the answer here will be the dose. Another question about the bioavailability, here number 7. Bioavailability of immediate dosage form depends on disintegration, dissolution, absorption, diffusion. Of course, it's dissolution. The rate limiting step in the absorption of the drug is the dissolution. So the dissolution is the rate limiting step. So the bioavailability of the drug depends on this step. Question number 8 is about pharmaceutics. All are correct about cetrimide except used for oiling water emulsion, or is a mixture of quaternary ammonium salts, number C, an antiseptic agent, or number D, it is anionic surfactant. In this question, there is an except word. So there is 3 choices are true and only one is false. From those choices, all of us knowing that cetrimide is a positive charge, so it is a cation, not an anion. So the answer here will be the D. It is anionic surfactant. For more questions and full revision, please contact us on our page on Facebook or with WhatsApp number. And to receive more videos, please subscribe the channel and click on the bell. Thank you and see you in other videos.